Hello, I'm Angela McGarvey. I'm recording my video for vitamin deficiencies. 2 billion people today are affected by deficiencies of essential vitamins and minerals and micronutrients, which can leave them susceptible to infectious diseases, impaired physical and mental development, reduced labor productivity, and increased risk for premature death. A vitamin deficiency can cause a disease or syndrome known as avitamintosis or hypovitamintosis. This usually refers to a long-term deficiency of a vitamin. When caused by inadequate nutrition, it can be classified as a primary deficiency, and when due to an underlying disorder, such as malabsorption, it can be classed as a secondary deficiency. What puts people at risk for this diagnosis? Much of the world does not eat a well-balanced diet. In fact, the Global Nutrition Report has found that 1 in 3 people globally are malnourished. For the developing world, this unfortunately is the result of a deeper systemic issues like poverty and food scarcity. But even in the developed worlds, our diets are routinely deficient in one or more micronutrients, which can lead to a variety of chronic and acute health problems. But some of us are at greater risk than others. Older people, especially those who are hospitalized or in long-term institutional care, individuals who are socially isolated, which are singles and mentally developed, people on low incomes, those who have deficiency absorbing nutrients, which bariatric surgeries, people with chronic eating disorders, such as bulimia or anorexia nervosa, people who are recovering from a serious illness or conditions, vegetarians, and exclusively breastfed infants. 3 questions that are essentially asked in workups for these diagnoses and why is: do you have any chronic or acute illnesses? Which deficiencies usually occur during a disease related to disease can develop under healthy conditions and generally occur during 1 to 5 mechanisms, which would be reduced intake, diminished absorption, increased use, increased demand, increased excretion. Number 2, do you have enough money to buy food or on a constant basis? Limited income can limit and inhibit the intake of vitamins needed daily. Number 3, do you have any digestive problems? Bariatric surgeries can limit the amount of food being introduced into the body and limit vitamin intake. Colostomies and ostomies do not allow full digestion of vitamins and minerals also. Describe the top 3 physical examination components that must be examined to provide adequate assessment for the diagnosis and why. A neurological exam, which you you look at their gait, their memory, cognitive impairment. Oropharyngeal exam, which is their glottitis, bleeding gums, which is your vitamin A, vitamin D, vitamin K, vitamin C, B12, and folic acid. Number 3, skin exam to look for mycosquamous dermatitis, photosensitive pigmented dermatitis, and petechiae, which would be your B3, B6, B12, vitamin A, vitamin C, and zinc, and your vitamin D. An overview of most common treatments for this diagnosis with expected outcomes would be: vitamins are best utilized by the body from food intake. Supplements should be used where it is not feasible to ingest the recommended amount of a particular vitamin, which would be medications, and diet modifications are the recommended way to treat vitamin deficiencies. List the 3-party teaching components that must be addressed with the patient to manage this diagnosis and why. In healthy adults, multivitamins have no value in a patient with an adequate diet and may increase risk of some cancers. During drug interactions may occur between vitamins and some medications. Patients should report all supplements along with medications to their healthcare provider. Risk of vitamin toxicity occurs most commonly with the fat-soluble vitamins A, D, E, and K. If you have any questions, just email me at mcgarvey.angela@yahoo.com. Thank you.